Well, I bet there's not a single person listening to the show this morning that hasn't been touched by cancer, even on a small level, whether it's a skin cancer or whether it is something that is so devastating to hear. And I know in my family, my father had lung cancer at the end of his life. It's not what killed him, but he had developed it. So I think it touches everybody. So we're glad to have Atlanta author Vincent Coppola, who has written a book, The Big Casino, and it's a book about cancer from many doctors' points of view. So welcome to the show.
Thank you and good morning.
Well, okay, I want our listeners to know a little bit about you. I mean, you have a large contingency of writing and journalism as it relates nationally and locally. Tell us what all you've done before writing this book.
Well, I arrived at Atlanta in 1979, actually, as a Newsweek reporter. And I stayed and covered news events in the Southeast for Newsweek for about 10 years. After Newsweek, I decided to stay in Atlanta, and I had a stint with Atlanta Magazine for about 3 years.
Wow. So you've written about Vicki Locke before then?
I never got to people at Vicki's level, but I'm working on it.
I know, because I think Vicki, she was always in there, that's a great magazine, and has been, certainly an Atlanta staple for a long time. This book is very relevant for Doc Talk and what we do. We want to get the word out because, you want to get this book out to as many people as possible to help them deal with cancer.
Yes, my own mother died of cancer, and many members of her family, brothers and sisters, developed cancer 25, 30 years ago. So it was always something that was out there for me.
Well, what made you decide to write this book?
Well, I was diagnosed with cancer. I'm a non-smoker, non-drinker, and suddenly I have throat cancer. I was first in denial and then staggered.
And you found retired oncologist Dr. Stanley Winokur to work with.
My cancer journey, it had a lot of turns and twists.
Yes,
I was not given an accurate diagnosis, and frankly, I didn't want to hear the true diagnosis.
That's
so I
right,
went from
sure.
doctor to doctor, hospital to hospital in Atlanta, and couldn't get a clear diagnosis. And finally, with Dr. Winokur's advice, and he's a friend, I went up to Sloan Kettering, and they diagnosed me within 5 minutes, really, of looking at the slides. And there I was, stage 4 cancer, facing chemotherapy, radiation, and then surgery.
Well, I want everybody to know that this type of cancer is within the scope of what we do at the ENT Institute, and generally is fairly easy to diagnose. Why did you have a problem with the diagnosis?
First of all, I guess like most cancer patients, I couldn't believe it. I had, not to get too specific, a dental implant procedure underway where they implanted some cadaver tissue to serve as a foundation for this dental work. And then a month later, a lump pops on my neck directly underneath where I'd had this work done. So in my mind, it had to be related, some immune response to this alien tissue now in my body.
And I bet you have found out, because I know from experience, that is not uncommon.
No, despite my dentist's protests, it turned out there were examples of this happening among people.
Absolutely.
And of course, I wanted it to be that.
And so you write this book, The Big Casino, and in it are different stories about people that have cancer, even your own story.
Well, what I've noticed is that when you are diagnosed with cancer, your doctor suddenly becomes either God, because your life is in his or her hands, or the devil, because they deliver very bad news. Me hearing stage 4 cancer, typically incurable cancer, was a shock. So I didn't want to believe what these doctors were telling me, and I had a biopsy where I was told pretty much that it was a cyst rather than squamous cell carcinoma,
which
as
is
it
the
turned
most
out to be.
common head and neck cancer.
Absolutely.
And rising pretty dramatically. So, tell me, why did you write this book from a doctor's perspective?
Well, I think nobody knows who these doctors are. You know, they keep a professional distance, as they should, dealing with so many patients. And I never had a sense of who my doctor really was at all. Plus, I was stuck there under treatment for about 4 months where I didn't have much mobility, I didn't have much energy, and I wanted to keep myself busy. And frankly, if I wasn't going to make it, I wanted to do something for other cancer patients who'd come after me. So with the help of Dr. Winokur, we wanted to tell a book. We wanted to get the best oncologists in the country. We got 35 of them. We wanted them to tell their personal stories, who they were, where they came from, why they do this, because it's a tough business to be an oncologist, because you face, even with the great advances in cancer treatment, a lot of bad news, and you give a lot of bad news. So I wanted to humanize these people.
And so why did you call the book The Big Casino?
Well, it turns out that maybe 25 years ago, among oncologists, you couldn't even say cancer to a patient. It would so freak out a cancer patient or a family member that they would use mostly medical terms, generic terms, not to say it, but among themselves, they would use the big casino, the big C, but
Right.
casino really communicates what the odds were like if you got cancer back in the 80s, 70s, 90s, all those years.
Well, and that is true. I can tell you, I've been unfortunate enough to have to tell at least a handful of patients that they have cancer. But fortunately, they were diagnosed very early in our case. But when you say cancer, the patient doesn't hear another word. And doctors need to be, very sensitive to it. And I think those docs who are in cancer treatment fields, especially the oncologist, there's no real training for that, other than observation. We all go through medical training, and they observe physicians in practice, and that's how we learn to communicate. But I feel in this day and age, of course, with all the data that we have, the means of communication, whether it's even on the web, there's a plethora, a large amount of information there that does help patients. But ultimately, you're never going to get rid of, thank God, that doctor-patient relationship.
Right.
And
so, cancer is very lonely. I mean, I felt I had family and friends and all this support, and I'm trained as a researcher, but I felt very lonely. And only by talking to these doctors and hearing about patients who'd come before me, patients who showed courage and compassion and strength and humanity, that's the core of the book, to let other people know they're not alone, others have gone before, and it doesn't have to be this terrible, debilitating, negating illness. So you meet these patients as much as you meet the doctors in this book.
And what I like about these, this is pretty easy to read. I mean, they're very, very short chapters with stories that you feel as a cancer survivor, as a cancer patient, people can relate to.
I do, and I also wanted to keep it original. Obviously, I could have polished and rewritten every one of these stories till they all look the same and all were gleaming and succinct and clever. But I wanted the doctor's own words. And let's face it, a lot of these guys are not writers.
They're not, and they're not much of a talker either, like me, unfortunately.
The ones that work, they're pretty devastating to read.
They are. Well, I tell you what, I want you to stay tuned with us. We're going to come back and hear some stories. We're talking to Atlanta author Vincent Coppola about his book, The Big Casino, a book written about cancer from many doctors' points of view. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.